So as related to the previous question, people are asking if COVID-19 long haul symptoms can cause permanent damage. So I answered part of that in the previous question. However, the symptoms do not necessarily correlate with permanent damage. COVID-19 is able to infiltrate and bind to all human cells and embed itself without possibly being eradicated. COVID-19 is clearly a multi-system complex infectious disease, and it can cause damage to the heart, which is shown up on imaging, as I mentioned. It can also cause long-standing damage to the lung alveoli, which is the little small air sacs, and cause the scarring, which I mentioned, which is similar to fibrosis and is present in some chronic lung diseases that we can use for comparison. And myalgic encephalitis, which is also known as chronic fatigue syndrome, and fibromyalgia are considered complex multi-system diseases like post-COVID-19 syndrome and chronic COVID-19 long hauler, and may also result from damage to multiple tissues and cells from the COVID-19 virus. As I stated, it can affect the muscle tissues, the heart, and the lungs, and the nervous system, and have the same effects and symptoms as myalgic encephalitis, chronic fatigue syndrome, and fibromyalgia. However, more studies need to be done.